Antimicrobial resistance has been recognized as a global health problem by health organizations as one of the top health challenges, with the recent rising concerns over the extensive use of antimicrobials and its immortality rate. Health officials in all the sector are upgrading knowledge on ways to prevent their cause, effects and consequences on humans, animals and the environment. Health experts will also focus on the relationship of drug resistance in people to antibiotic use on animals and food, not leaving out the inappropriate use of antibiotics for non-bacterial infections.
First thing is that with the misuse and wide distributions of antibiotics and the residues, they find themselves everywhere in the environments, and normally when they are spreading into food which is not controlled, they can create resistance at the level of the different pathogens which exist already, and we know that most of these pathogens can be mutating very fast. So at the end, not only they are having themselves found in the food that we are consuming, and we know that if they are just introduced into our organisms, some of those antipathogens or antimicrobial products that are used for plants or for animals are the concentration is sometimes very high and not really applicable to human beings. So when they find themselves into our organisms, they can create resistance in such a way that the different antibiotics or antimicrobial substances that are normally used at the normal dose for human beings will no more be effective.
Antibiotics are medicines used to prevent and treat bacterial infections, and resistance occurs when bacteria change in response to the use of this medicine, leading to high medical costs and increased mortality.